Save My Piggies, Your Life, Your Limb, Your Story, with host Dr. John Phillips and Kim McNicholas.
I'd like to introduce the one, the only, legendary Harlem Globetrotter, Larry Shorty Coleman. Larry's journey started quite a few years ago. Actually, he was a former athlete, as we all know, and very famous in the Harlem Globetrotter world. And he ended up, his mom actually had an amputation related. They said it was related to diabetes, but now he's wondering if this was also a poor circulation related and just was not called peripheral artery disease at the time. And fast forward, he ended up experiencing, some leg cramps and symptoms of P.A.D. And he goes to the hospital. And of course, they want to go straight to amputation. And he said, absolutely no way. Right, Larry?
Yes, I agree 100%. That was the craziest thing I ever heard.
And so when did you start experiencing symptoms? I mean, you were an athlete. Poor circulation is probably the last thing you expected to hear that you would be suffering from.
Yes, by far, because it started out like it was a cramp in my leg or just a muscle spasm. And then it got worse. It felt like someone was stabbing me in my calf of my left leg.
And so how long between the time you started experiencing those symptoms and actually seeking care for them? Because I would imagine that you probably thought you might have had a muscle cramp, you pulled a muscle, it was some sort of athletic injury, but not something that would be a chronic ailment.
You're 100% right. I thought it was just something that I had twisted the wrong way, or someone could have hit me in it while we was playing basketball. But I waited for like 2 to 3 weeks, and the pain got worse and worse. And then I went to emergency, and that's when it all started with let me amputate. We probably gonna have to amputate right away. And I was like, oh no, this ain't happening. So I had to stay in the hospital, and I waited probably after 8 surgeries and realized that it was deeper than just a muscle pull or muscle spasm or cramp. And I said the pain was so excruciating, I had no other choice but to make the decision without having knowledge of it. And boy. But I still wake up every day.
You do. And so during the time that you were in the hospital, when they said amputation, did they offer you any other option, or what was the reason for amputation upon your initial presentation of symptoms of leg pain and leg cramps?
Well, that was just an emergency doctor, and everybody there was saying once he went out and made his statement that he's going to have to amputate right away. And I said to myself, and I prayed about it, and I said, there's no way that's going to happen. So I asked to speak to about 6 other doctors, and they said he had no business telling you that. We
Oh,
first
well,
want to
that's
see if we can save your leg.
good.
But
And so they
unfortunately,
tried. And how long between the time that you initially went to that hospital and you ended up having to go back to the hospital following, you said, 8 procedures where they attempted to, I would imagine, restore blood flow using minimally invasive tools such as wires and balloons and that kind of thing. How long, what was the time frame between that first hospital experience and the second one where you ultimately ended up with amputation?
well, it lasted about, I'd say, maybe a month, because I was really not wanting to have that done. And basically, I went from one doctor to another and trying to get it done. This doctor was supposed to be great at uh, opening up the blockage or clot. It was a blockage, really. That's what they was telling me. So it took about a month and I had to be hospitalized.
And I'm imagining, what was the pain like? Must have been excruciating.
Yes, the pain was very excruciating. And I'm here to tell you, it just felt like the nerves and everything was set off all at once, feeling like someone stabbing you in your calf, and it just blew me away. And I was like, something got to be done.
And
then,
at that
of course,
point, where you realized something had to be done, could you imagine that there was any other option that could relieve that pain except to cut it off?
I think with all the drugs they was giving me, and the pain was still there, and I was like, this is not helping. And like I said, I'm the first to say I didn't have the proper knowledge of it, and so when you're trying to save your leg, you just go through these doctors, and hope they're telling you the truth.
Yeah. Do you know what type of procedures they did to try and open up your blood vessel? Do you know if they took the wires and balloons down into your calf and into your foot, which, having worked with you now, over the past year, I know that you have a lot of below the knee disease. And so I'm curious if the doctors, or if you knew whether the doctors had tried to take those tools and open up those vessels below your knee, or if they just stopped at your knee.
Well, they tried several things. They used a balloon. They went in with what is this? Some type of wire, and then what is it called? Put in a stent, and none of that was working.
None of it was working. And so,
No.
what was the catalyst for you finally saying, you know what? I can't do this anymore. I can't go through this process. I just can't imagine that anything is going to work. Doctor, it's time to amputate.
Yes. After eight surgeries, and the pain was still there, and just as great as it was in the beginning, I was in the hospital, and about 3 o'clock in the morning, I said, I'm not getting any sleep. I'm stressed out about this, and pain got so great where I told the doctor, just remove. He said it would be below the knee, which he tried first. And I went through that process, and like the majority of people, it got infected, had staples in it, the biggest I've ever seen. And believe it or not, it went above the knee. All right.
Larry, if I might ask a question, or
Yes,
it's not uncommon for patients who have the pain that's so intense to say, you know what, just take the leg. But so you have the amputation. What about your other leg? Was your other leg healthy, or did you have problems with that one as well?
During this time that I had my left leg amputated, I didn't have any problems with my right leg. But it's a great question, because now I'm going through pretty much the same thing with the other leg. But thanks to Kim and Dr. Red and his staff, it's much better than what it was, because it was getting pretty bad. Weak. It was getting weak. There really wasn't no pain there. It was getting very weak.
Sure. But the other issue too is now you have an amputation on one side. You're an active guy, you're a former athlete, and you want to get up and move around. So now you've got to get that prosthesis, that whole process rolling. And you also have to keep the healthy, quote unquote, healthy leg healthy, so you can ambulate with that. So you've got a big hill to climb at this point, right?
Yes, I do. And believe it or not, this is my second prosthetic leg. And when I put it on and I walk in the house, I just started back doing therapy, strengthened my right leg first for about the first two to 3 weeks, she said. And when I put it on, I could tell that the right leg gives out sometimes. Not a good feeling, because it's not nice to fall and not know how you're going to land.
Yeah, I can't imagine. So, Larry, what gets you up every morning? Like what motivates you to get out of bed? Because there are a lot of people in your situation. Just mail it in.
Yeah, for anybody that's going through what I'm going through, the good Lord that wakes me up every day really gets me going. I have that moment of, oh man, why can't I just get out, walk to the bathroom, brush my teeth, wash my face, use the bathroom, and so forth. But I get past it by knowing that I probably could have lost my life experimenting with all these different doctors. So I know I'm still here for a reason. And I'm the type of person that I won't give up on trying to walk. That's for sure. I'm going to give it the biggest fight of all. And I advise everybody else to do the same. Don't let one limb, two limbs, three limbs just think positive and say, I'm still here and I got a reason to be here.
And you know what, Larry, I mean, you are incredibly inspiring. I still remember that first phone call when you called our Lifesaver hotline and you said, hello, is this Kim? This is Larry Shorty Coleman. I hear you're going to save my leg.
Yes, and then you sure sent me to the right doctor, because he's on top of it, and I've had about 4 appointments with him, and it's been really, really a good thing, because he didn't say he's going to do surgery. He said he's going to do a procedure. So he was able to do on my right leg, open up 2 blockages, and one he could not. But he said, your blood is still flowing pretty good, so we're not going to do anything at this moment. Just want you to come back every 3 months.
And any regrets now?
No, I don't have any regrets. You know, you make a decision, and I'm the type of person, I live with it, and so far it's been pretty good. Only thing I don't like about it, it's difficult for me to get back to the type of work I want to do and not have to be in pain, or I'm not ashamed of it, because I want everyone to learn from it. Kids, grown-ups, because I'm not the only person going through this in life.
Not at all. And I'm curious, I want to go back a little bit about, living, life as an amputee, and what is it that doctors may not realize when they say that you need an amputation and they haven't exhausted all efforts that are out there, and they consider that amputation is better for the patient, that they're going to be so much better off. What is the reality of life directly following the amputation? You are sent home in a wheelchair, and how long before you are able to get out of that wheelchair, your wound healed, and get the prosthetic fit so you can get on your feet? What's that time frame?
Well, when I first went to therapy, they was telling me that it's probably going to take me a year to walk, which I didn't want to hear. And I had different people calling me, wanting to use, being a former Globetrotter and come to Florida. I went to Florida in Orlando and to POA, and you wouldn't believe it, I did walk the second day there. And I was, boy, you talking about a very happy individual. But that was only the beginning. There's no way I'm going to keep going back to Florida and back to Georgia.
And so, what were some of the challenges when you were at home, and, you would wake up in the morning and you would end up having to use the restroom? Did you ever forget that you were missing a leg, and ended up trying to get out of bed and, oh my gosh.
Very good question, because that happened about 2 or 3 times. But after you fall, you start to realize. And then most craziest thing, I had a dream I was playing basketball, and down on the floor I went, hit my head, and I started saying to myself, move over further to the wall and try to end some of these dreams and move forward with what the situation is, not having but 1.5 leg. But believe it or not, I take the lumps and the bumps, but I tell you, it depresses you really bad, especially the falling part.
Yeah. No, I can imagine. I mean, that's the part that we hear it all the time from a lot of our fellow P.A.D warriors that are here and who will be speaking later on in this conference, that that's one of the toughest things. And that's where, how many trips to the emergency room do you end up having as, a recent amputee, and as you're trying to learn the process and get used to life with one limb?
Well, you really don't have a choice once it's already been amputated. It's up to you to put that first foot forward. And when you get the prosthetic, your goal should be to take one step leading into 1,000,000 steps if possible. But
Right.
it's not easy. I make it sound easy because I'm a very competitive person. And for those that's not, just think of others. Like I look on the Google and see people with no arms, no legs, and they're doing miraculous things in life. And seeing kids really does it for me. But I have respect for everybody that's an adult too that's going through it.
And I have one more question for you, Larry.
Yes.
Hypothetically, there is some new legislation that Congress is considering. It's called the ARC Act, the Amputation, Reduction, and Compassion Act. And one of the aspects of it is to require Medicare and other private group insurance to cover early testing for P.A.D. for all of those with high risk factors. Having a family history with your mom having diabetes and having had her leg amputated, you would likely qualify for early testing. If there was early testing, such as with colon cancer or for women with breast cancer, would you have volunteered to go in and been assertive with your doctor to go get tested earlier rather than later?
I would prefer to go earlier than later, because it's individuals out here like Dr. Phillips and plenty other doctors. But I'm so glad he comes on and enlighten us with some of his professionalism as a doctor. And hearing him make me think that I could have saved my leg. But in reality, it's gone. So I would definitely want to join that act that you're speaking of.
Yeah, I think it's really important. What are some words that you would like to share? Um, let's say for, you know, lawmakers and doctors and even patients alike, that would inspire them to be to do something different, when it comes to P.A.D and to improve the care with P.A.D.
Well, I would like to tell anyone that's going through talking about having an amputation, do research on it yourself, as well as calling someone that can put you on the phone with a doctor, or going to see him if it's local. And the most encouraging thing is this: fight to the end before you give up your limb, whether it be your little piggy or it be your broomstick is what I call mine now. And stay prayed up and just deal with it. Because if you wake up, that's the greatest part of all.
That is absolutely beautiful. And John, any final questions for Larry before we just thank him so much for being here and all of his inspiring words?
No, I think that's exactly it. His inspiring words, the fact that he's never given up, because a lot of patients kind of give up, and they don't have an outlet, to a forum to kind of interact with. And this is the beauty of Save My Piggies and the Heart of Innovation. We have a lot of ways to help people, not only as physicians, but also through the weight of my heart and connecting patients to other patients, and kind of, it's a support network basically. And Larry, keep that positive message, keep doing what you're doing. You're inspiring people, and you're saving piggies, my friend.
All right. Thank you very much. And you're doing a great job yourself. And Ms. Kim, Way to My Heart was like a door opener for millions of people that don't know what you're telling them every Saturday. Imagine if this was on a TV show, they would be glued to it. They probably have tears, but the tears would surely turn into a smile, because you know you accepted the fact to have your leg amputated. But in reality, you still have another leg, because I'm told that P.A.D. travels. It stays with you for a lifetime. So whatever you at and whatever you're doing, do your homework. Even though that's some hard stuff to do when you say do your homework, but find the right person and get more than one advice. And try to fight the pain as much as you can. But drugs that they give you, they only make you feel like it's okay for a minute. I'm just saying a minute. It could be 30 minutes to an hour to 3 hours. But when that 3 hours is over and the medication is adapt to your system, that's just like chewing gum. When the flavor's gone, you got to get rid of it. So I wish and pray that everyone keep fighting. And we're here as a family, and feel free to contact Kim if you need to speak to me. I'm not a lifesaver, but I'm an inspirational person that wants others to feel as good as I do after this situation. And I definitely was feeling greater before.
Thank you so much, Larry. You are so courageous and so inspirational. We appreciate you so much.